Hi, everyone. Thank you so much for joining us. We're just going to take a couple of minutes to get more people to join us, and then we'll get started. Thank you so much. I see that folks are trickling in. Welcome. We're going to get started shortly. Again, thank you so much, everyone, for joining us. We're going to get started in just a minute. Just waiting for a couple more folks to join us. So again, thank you. Welcome, everyone. See that folks are slowly trickling in. Welcome, everyone. So I'm very happy to be here. My name is Bianca Sierra Wolf. I'm the Executive Director of the Lawyers Committee for Civil Rights of the San Francisco Bay Area. And I know that many of us are here today because we are concerned about homelessness issues in San Francisco. And I know it's hard to know what's what, and we hear a lot of different information. And so I think today is going to be a great chance for us to hear from folks on the ground, experts who know exactly what's going on and what potential real solutions there can be to the problem. And so I'm thrilled to introduce our wonderful panelists that will be with us today. They're each going to speak, and then we'll save some time at the very end of the presentation in case folks have any questions. If you do have questions, you can enter them in the Q&A box. But again, we won't be answering those until the end of the presentation. So our panelists today include Professor Sarah Rankin from the Seattle University School of Law and Director of Homeless Rights Advocacy Project. We'll have Jennifer Friedenbach, Executive Director for the Coalition on Homelessness San Francisco. Then we'll have my colleague Zal Shroff, Acting Legal Director for the Lawyers Committee of Civil Rights of San Francisco Bay Area. And then last but certainly not least, John Doe, Senior Staff Attorney of the ACLU of Northern California. And so now it is my great pleasure to turn it over to Professor Rankin.
Thank you so much. So since you're all here, you're inevitably aware that we are in a dire homelessness crisis. In last year's official count, conservative estimates were that we had about 582,000 Americans who were experiencing homelessness. And so while this number, which is staggering in and of itself, because it's well over 500,000 Americans, while that number is staggering, the estimate is a radical undercount. And some estimates actually place the real number to be 3 times or more higher than that. Most of the people experiencing homelessness are individuals, something around 72%. But a significant portion, about a quarter or 28%, are people who are living in families with children. In the 2022 counts of people suffering from chronic homelessness, which is the most visible form of homelessness, reached record highs from the beginning of whenever they were starting to collect that data. And in the midst of all of this, homeless service systems are still expanding the number of temporary and permanent beds, but those resources are still falling way short of everyone in need. And so the big question is why? And the answer is homelessness is a housing problem. The primary cause of our homelessness crisis is our housing crises. There's simply not enough affordable housing for millions of low-income renters in our country. Nationwide, there's only 35 affordable units that are available for every 100 extremely low-income poor renter households in need. So numerous studies have proved that even modest increases in rent are associated with very significant increases in homelessness. If you want to learn more about this, I'd really recommend Professor Greg Colburn's book, which is aptly titled Homelessness is a Housing Problem. And in that book, he examines data from the 30 largest metropolitan areas throughout the United States, and he tests a range of conventional myths that are very popular about what we think drives the prevalence of homelessness in any given city. So looking at questions, is homelessness the product of mental illness? Is homelessness the product of drug use? How does poverty affect it? Does weather affect the rates of homelessness? What about liberal ideologies, liberal policies? Are those contributing to the problem? And he concludes that none of those common myths explain why, for example, Seattle has much higher rates of homelessness than Chicago. And instead, what Colburn does through this really exhaustive data-driven analysis is conclude what we've seen borne out in a number of other studies. Housing market conditions, especially things like the cost and availability of rental housing, is the clearest driver of homelessness. So at its core, homelessness is a housing problem, and any approach that does not lead with housing will fail to stem the crisis. Next slide, please. So criminalization does make homelessness worse, and criminalization in this context helps us think about how the law contributes to the problem. Criminalization refers to laws that prohibit or severely restrict a person's ability to engage in necessary life-sustaining activities, even when that person has no reasonable alternative but to do so in public. And examples of criminalization laws include laws that prohibit sitting, standing, sleeping, eating, going to the bathroom, asking for help. All of those actions are things that none of us could forego for very long and still survive. And yet people who are involuntarily unsheltered have no option but to trip the wires of those laws and incur potentially life-altering consequences, like being hit with civil infractions, significant fines and fees, and criminal charges as well. Criminalization laws are growing nationwide. The National Homelessness Law Center has been tracking about 187 cities for well over a decade, looking at their laws and determining how they're growing. And their work demonstrates the dramatic proliferation of these laws across the United States. Just a couple of examples: citywide bans on camping in public. I'll say it again, citywide, meaning there is no place in that city where someone can be unhoused and in the presence of the public. That those laws are up 92%. So those laws have spiked 92%. Bans on sleeping in vehicles and vehicle residency is one of the fastest growing forms of homelessness. Those bans have spiked 213% nationwide since 2006. And so criminalization is proliferating. Camping bans, which are particularly of interest to this webinar, are written in different cities to cover a really wide range of activities, including merely sleeping outside. And they can be written so broadly that it makes it illegal for unhoused people to cover themselves with a blanket to protect themselves from the cold. Fining already poor people is not a solution to homelessness. It makes it worse. Processing already vulnerable people through the legal system and jail is not a solution to homelessness. It's proven to make it worse. So we know that criminalizing homelessness does not solve it. And in fact, it's adding fuel to the fire. Again, if you'd like to learn more, you can see a lot of information on the Homeless Rights Advocacy Project's webpage and also on the webpage for the National Homelessness Law Center. Next slide. So sweeps in particular are a great example of how criminalization is ineffective, expensive, and often illegal. First, sweeps traumatize unhoused people. Forced displacement is traumatizing. During sweeps, unhoused people are often separated, torn apart from loved ones, pets, and familiar communities. Their private belongings, things that are critically important, like identification, medication, wheelchairs, bikes, and legal documents, as well as precious items like things of sentimental value like military documents and family photos, children's schoolwork. Those are commonly destroyed or lost in the course of a sweep. Second, sweeps often result in fines and fees that are shown to perpetuate the cycle of poverty. So fines can prolong the amount of time that someone will experience homelessness by leaving them less able to pay for food, transportation, medication, and other necessities. They can prevent a person from being accepted into housing, and they can even cause someone to go to jail for failure to pay those fines. Third, sweeps as many forms of criminalization harms public safety. That may seem counterintuitive, but the research shows that sweeps divert law enforcement resources away from true street crime, clog the legal system with unnecessary arrests, and strain already overcrowded jails. They also erode trust between unhoused people and the police, which then heightens the risk that there will be violent confrontations during sweeps and leaves homeless people without the protection of police when they need it. So those are among the reasons why the Department of Justice at the federal level has filed all sorts of briefs and issued guidance arguing against enforcing these sorts of laws. Fourth, sweeps harm health. They've been shown to threaten public health by dispersing people who have no private place to meet their basic sanitation, hygiene, and waste disposal needs. So, for example, there's a number of reports that show that COVID and hepatitis were spread by encampment sweeps as opposed to contained or bettered by them. I mentioned before the destruction of people's belongings. Tents are one of those commonly destroyed items, and that leaves unhoused people more exposed. It causes stress and sleep deprivation, further loss of sleep, which contributes to the worsening of their physical and mental health. So there's a bunch of research on this, including a really compelling study. It was just released earlier this year from JAMA, the Journal of the American Medical Association. And it shows that sweeps separate unhoused people from critical services and dramatically increase the likelihood of overdose, hospitalization, and even death. So those are among the reasons why organizations like the American Medical Association and the American Public Health Association have condemned sweeps as harmful to health. So in summary, sweeps make homelessness worse by traumatizing already vulnerable people, creating barriers to housing and services, and wasting taxpayer dollars. And that really ultimately is a diversion of resources that could be used on real solutions to homelessness like housing. Final slide, please, for me. Thank you. Others on this panel are going to address the myth of service and shelter resistant people. The truth of the matter is that services and shelter are people resistant. One resource you can consult for a lot more on this is a report on the Homeless Rights Advocacy Project's website called Shut Out, which details a number of examples. You'll hear about a number of examples in the litigation later. But in the interest of time, I'll offer this observation. The reality is that we have taught many unsheltered people to distrust offers of shelter and services because they have learned time and time again that these offers are misleading, not real, completely inaccessible, or just inhumane. And so again, if we want to stem the homelessness crisis, we have to do better. I'll pass things on to Jennifer.
Thanks so much, Professor. Jennifer Friedenbach of Coalition on Homelessness. I was going to talk a little bit about the organization, just to let folks know, who is this organization that's suing the city. And, our mission is to organize homeless people and their allies to find permanent solutions to homelessness and to protect the human rights of folks who are forced to remain on the streets. Next slide. And how we do that is that we do community organizing. And so we engage homeless people who is a population in San Francisco and in cities across the country who are demonized, hated, really disenfranchised on so many different levels and ignored oftentimes when we're talking about solutions. And so we really try to engage homeless people, center them in the creation of solutions. And our advocacy agenda is directed by input from homeless people that we gather daily on outreaches. And then we take that information and create an advocacy agenda. And we really try to ensure that we're lifting up their voices, ensuring that folks can speak for themselves. And then for folks who can't, because they're in the middle of this crisis, are unable to attend hearings or meet with politicians, we advocate on their behalf. Next slide. Apologies for the dog barking in the background. So I wanted to talk a little bit about specifically the humanitarian crises that we've been facing here in San Francisco. We have about 4,300 people in a point in time count from the city that are unsheltered, trying to survive on our streets. Several thousand more people are homeless in our shelter system. The reality is that the city has an acute lack of shelter services and affordable housing. And in fact, we have over 500 people who are desperately waiting for shelter on the recently reopened city shelter waitlist. Next slide. So I want to just really drive home the point that homelessness in San Francisco and across the country is really driven by racism. In San Francisco in particular, over 40% of our homeless residents are Black, even though African Americans only make up 5.7% of San Francisco's total population. Next slide. And, when you look at homelessness, you really see these intersections of different oppressions, whether that's homophobia, racism, disableism, et cetera. And just as one piece here, we found that 66% of Black homeless residents in San Francisco have lived in the city for more than a decade. I really want to highlight that because much of, when you walk into a homeless shelter or you're doing outreach, you're finding a lot of folks who are African Americans, longtime residents that have been displaced from the Fillmore, folks that have been displaced from the Mission, folks that have been displaced from the Bayview. Next slide. And when we look at look at the LGBTQ community, 30% of our homeless population in San Francisco identifies as LGBTQ. And we look at the trans community in particular, they're 18 times more likely to experience homelessness. So it's really where homelessness and these different oppressions are intersecting. So looking at why folks lost their housing, this really illustrates how much housing is driving homelessness. And 43% of people lost their housing because they were unable to pay rent. Another almost 10% because of no-fault eviction, or they were chased out by their landlords. So we're really looking at the real estate speculation and these pressures on the rental market driving up homelessness, specifically in San Francisco and up and down the West Coast. Thank you. Next slide. And then once folks are homeless, in terms of what's their obstacle to getting out, again, it's this housing piece. Can't afford rent, 39%. Not enough income, no housing available. So when we see that, we lack an investment in making up for that severe disparity between incomes and rents, we end up with this crisis. And of course, as was mentioned, in cities with higher housing costs and increases in rents, you see higher numbers of homelessness. Next slide. So looking at the city of San Francisco, we hear a lot in this broader policy debate about how much money San Francisco is spending on this issue. Just wanted to point out that our $14.6 billion budget in San Francisco, only 5.5% goes towards solving homelessness. So paying for housing, for shelter, for street outreach teams. However, because we're not addressing homelessness and people don't have the opportunity to get off the streets, we're ending up with these other costs that could have been avoided if folks had been in housing in the first place. So we know that there's millions of dollars wasted, of course, on criminalizing homeless people that could be spent otherwise. There's also healthcare costs. Homeless people are 25 years elder, their calendar age, in all areas of healthcare. And so you see homelessness is really killing people. We would be spending a lot less money if we simply housed people from the beginning. Next slide. So common sense solutions to end homelessness. We absolutely need to invest in prevention. And, this is a place where San Francisco has really fallen down. It's the most cost-effective way to address homelessness is to keep people in their homes. Remembering that early slide about people not having enough money to pay rent, short-term, medium-term, and long-term subsidies, depending on the situation. Maybe someone has a short-term healthcare issue. Maybe they're a laborer, broke their arm, they're out of work for a short amount of time and need a little bit of money for help for rent. Or it could be someone who's has a disability or is elderly and their income is not keeping up with the annual increase they're seeing in rent. And so a very small subsidy would help them stay in their homes. And so, in the long term, so investing in prevention is huge. And oftentimes that needs to be partnered with legal assistance. For those that we are not able to prevent from becoming homeless, we need to make sure that we have enough shelter beds for them, because we don't want folks to end up on the streets and then they end up incurring a lot more damage to their body and a lot more trauma. But we don't want people stuck in shelter. Shelters are really expensive. In San Francisco, if you look at the costs over many years, we spend more on shelter beds than we do on housing. And so we want those shelter beds to turn over. We want it to be short-term stays. Shelter is not a permanent state. It also has its own level of trauma. We really want to get folks stabilized in housing so folks can move out of shelter. That bed opens up for the next person, and then we're solving homelessness in housing. And when we're talking about housing, we're not talking about new construction. New construction is great. We need more permanently affordable housing and new construction and additional units, of course. But we're also talking about acquisitions. We're also ensuring that public housing is turned over to formerly homeless people. We need to make sure that that we are providing rental assistance in the private market so that folks can also rent in the private market. So it's a mix of different housing strategies, that some are more cost effective than others, and they each have their ups and downs. But of course, we have a diverse homeless population, and we need diverse housing solutions. And these also can be things from boarding cares to, housing that has additional deep support for folks with severe mental illnesses so that they can live on their own, up to folks that just need straight up rental assistance without a lot of support services. So, and then lastly, we've got to cut off those barriers that are keeping people on the streets. And one of the huge barriers, and this is the primary response to homelessness in San Francisco, is really a criminalization response. If I have someone out in front of my home and I call the city, whether I want them gone or whether I want them to get some help, it's more likely than not, overwhelming majority of the time, it's going to be a police response. And that response ends up, as we talked about, exasperating homelessness and being and really working against us. Other barriers are having a complicated housing access system or shelter access system, and a lot of bureaucracy and red tape. So all of these things are barriers that need to be eliminated while we're working on prevention, emergency shelter, and having more housing. So,
and thank you so much. Thank you so much, Jenny. So I think now is a good time to turn it over to Zal to talk a little bit more about the actual litigation.
Sounds good. Hey, everyone, I'm Zal Shroff. I'm the acting legal director at the Lawyers Committee for Civil Rights of the San Francisco Bay Area, and I'm one of the lead lawyers on the litigation against San Francisco, along with John from the ACLU, who you'll hear from in a moment. And I wanted to start with why we're here today as the lawyers. We brought this lawsuit to help address San Francisco street homelessness crisis. And that's a goal that we know that San Francisco shares. This is one of the most important issues facing our community, and it's one that we have to get right. And part of what's really heartening is that we are also on the same page with San Francisco about the solutions to the homelessness crisis, because the city understands the data that Professor Rankin and Jenny just presented to us. It understands that homelessness is a problem of affordable housing. The city's own planning department acknowledges that street homelessness crisis in San Francisco is a function of San Francisco failing to provide 60,000 plus affordable housing units for longtime residents over the last 40 years. In what the Newsom administration recently called a, quote, egregious record on affordable housing. And the city's own policies rely on the social science research and promise a housing first solution that could actually help end street homelessness. So then the question is, why are we here? And we're here because there's a huge gap between the city's written policies and their good intentions on the response to homelessness and then the actual outcomes. And that's rightly frustrating to taxpayers and to all residents of San Francisco who want to see an end to this crisis. So we need to get real about what the city is doing in practice, because San Francisco has told the public time and again over the last several years that it is solving the homelessness problem, that it is building shelter and affordable housing, that it is offering people services they need to get off the street. And that those few bad apples who are still on the street, they're the real problem driving homelessness in San Francisco, and we should punish them and use a criminalization response. Now, that's been the rhetoric for years, and it's also false. This lawsuit collects years of data to show that the city is not doing what it says it is. So we'll start with some basic facts. And some of this was covered by Jenny and Professor Rankin. The majority of San Francisco's homeless population, the majority of folks, are living unsheltered on our streets. That's literally thousands of people. That's not just the few bad apples or people with substance use or addiction challenges. It's most unhoused people. And why is that? It's because San Francisco shelters are at full capacity. The city is quite literally 2,000 to 4,000 shelter beds short. And it's a direct result of that shortage that unhoused people are forced to sleep on our streets. And that's before we even get to the failures of affordable housing. Second, the city is claiming that it's offering shelter to every unhoused person who wants it. Now, the city can say that it has enough shelter and services to offer people until it's blue in the face, but the numbers don't add up. We have months of shelter availability statistics to show that the entire shelter system in San Francisco barely has more than a handful of beds opening up every day, if any beds open up. So the city doesn't have much to offer unhoused folks, and the shelter waitlist system has hundreds of people on it. So people can't secure shelter even when they're actively seeking it. And in fact, hundreds of people also used to be waiting in a line for shelter that was a same-day line when those lines were available. The city has shut those lines, and they haven't opened, frankly, in part because of the embarrassment of demonstrating just how many people cannot afford to make ends meet in our city and who are seeking shelter. So instead of providing shelter and services or affordable housing, what the city is doing is spending millions of taxpayer money harassing homeless people who have nowhere else to go, threatening them with citation and arrest, and stealing their tents and blankets when they go to work or they look to find housing. And the result is that people who are just trying to get back on their feet are left with absolutely nothing. Meanwhile, the city claims it's ending street homelessness when all it's doing is terrorizing people and throwing away their stuff, which only ensures that they stay homeless. And that's happening to thousands of people every year. So when the public asks, why is there so much homelessness in San Francisco, or how has it gotten this bad, the city's not giving an honest answer to that. It's not saying that it's actually part of the problem. And it's trying to hide that the failures to provide adequate shelter and affordable housing are in fact the driving causes behind homelessness in San Francisco. And so that's what this lawsuit is about. We've brought the lawsuit because there's a profound gap of accountability on the part of our politicians for their role in perpetuating the homelessness crisis. So let's talk about precisely what's going on here and why it's not just bad social policy. I think we've heard that from Professor Rankin and Jenny very clearly, but also why it's a fundamental violation of people's constitutional rights. And that starts with the Eighth Amendment, which is the constitutional protection against cruel and unusual punishment. Now, the Supreme Court for decades said that you can't punish someone for a circumstance that they cannot control, because you can't have punishment without wrongdoing. So someone has to have actually done something to deserve punishment. In other words, arresting someone just because they're too poor to afford a home when they haven't committed any crime is a violation of the US Constitution. And that's why San Francisco has a stated policy that says we will not cite and arrest people who have nowhere else to go if they're unhoused. But the problem is that San Francisco doesn't follow that policy. Our lawsuit has revealed that San Francisco cited, fined, and arrested upwards of 3,000 unsheltered individuals over the last 3 years alone, when we know that the city shelter system was functionally closed, inaccessible, and there was a 1,000-person wait list for shelter. And in response, the city could not present one shred of evidence to suggest that it offered any of those thousands of people shelter prior to citing and arresting them. And that's a regressive mass incarceration era criminalization policy that all the data again shows does not work. You can't solve a housing crisis with handcuffs. It also conveniently scapegoats the people most impacted by the city's affordability crisis while making it impossible for people to get back on their feet. And again, banning this kind of enforcement is the city's own policy. They just haven't been following it. And next we can talk about the Fourth Amendment. So the Fourth Amendment says you have a right against unreasonable searches and seizures of your property. Now, what does that mean? It means the government can't come like a thief in the night, take all of your worldly possessions, and destroy them without explanation. And that's been a hallmark of American jurisprudence almost since the American Revolution. So again, San Francisco has a policy. It says, sure, we can remove unhoused people's belongings from the streets, but we cannot destroy people's survivable belongings and valuable belongings. We have to safeguard and store those. And so again, the city is allowed under its own policies, under the Constitution, to remove people's belongings from the street when it's appropriate, when there's notice. But what you can't do is destroy someone's survivable belongings, their tent, their bedding, their MacBook laptop, their cell phone, their work clothes. These kinds of property destruction campaigns violate people's Fourth Amendment rights, and they are meant to be punitive, even when the city has provided no place for people to shelter. And this is something that the federal court found in our case happened dozens of times in clear violation of the city's own policies, often even recorded photographically. And in addition to the dozens of judicial rulings against the city and settlements for property destruction, where the city acknowledged that it destroyed individual survivable belongings. So just taking a moment with that and just describing what's going on here, this is some fairly egregious conduct. And I just want to share with this audience what this means for all of us, because it means that the city is spending millions of dollars in our name to harass homeless people instead of creating the affordable housing we know we need so that we can all live a better quality of life in our city. And, there's this mistaken belief that homeless people come to San Francisco because we're known to be more friendly or we're too lenient. And that's particularly ridiculous given that San Francisco has more laws criminalizing homelessness than any other place in America. And they're using them to terrorize thousands of unhoused people on a regular basis, as this lawsuit points out. And again, we also know for a fact that the vast majority of unhoused people in San Francisco are actually from here. Most were living here or working here for a decade or more prior to becoming homeless, and they can just no longer afford their rents and are being pushed out onto the street. So the final question is just to leave the group with, why is the city targeting its most vulnerable residents? We know that punishing poverty doesn't work. We know that policing poverty doesn't work. Pushing people from block to block without offering them shelter or housing doesn't work. And so at a minimum, we need San Francisco to start following the law and to start following its own policies. That's what all residents of San Francisco deserve, and that's what this lawsuit is about. It's about closing the gap between intentions and outcomes so we can see an end to this crisis. And all we need are court-supported accountability mechanisms to make that a reality, to hold San Francisco to account. So moving to the here and now, we have our injunction against the city, and I'll let John talk about the details there since there's been a lot of confusion about what the injunction does.
Thanks, Zal. So Zal just spoke a little bit about the lawsuit in this matter, and I'm going to talk specifically about what the injunction that we currently have in place, what it is and it isn't. So there's currently a preliminary injunction in place. That is an order from the court before trial that is based on a finding of the court that we were likely to succeed on our case if it were to go to trial. And trial isn't scheduled until October of 2024. And so in asking for this injunction, the Coalition of Homelessness, unhoused folks, and us attorneys presented to the court a large amount of public data, the city's own data, dozens of declarations of unhoused folks, people who have been victims of sweeps themselves or folks who have observed hundreds of sweeps in total, declarations from former city employees that also verify the poor conduct that we were seeing here. And all of that presented to the court showed and established that San Francisco cited and arrested folks thousands of times over, and also destroyed their personal belongings at the same time. And San Francisco would do this even when there was no meaningful access to shelter at the time. So as Zal mentioned earlier, we presented 3,000 instances of citations and arrest for of homeless folks for essentially being homeless. And San Francisco did not provide a specific response to those 3,000 instances, claiming or even arguing that they actually offered shelter in those cases. So because of that, the court issued an injunction and found that the city likely violated the U.S. Constitution and also the city's own written policies. So what does the injunction do and not do? What the injunction isn't is a complete ban on addressing encampments. So San Francisco can still enforce its variety of laws and policies with regards to maintaining clean and accessible streets and enforcing all other laws, including drug laws. The injunction has nothing to do, does not impact that at all. And San Francisco can actually also enforce their specific anti-sit-lie, anti-homeless laws when they make a specific offer of shelter to homeless residents, and for some reason that person were to decline. And of course, the injunction doesn't prohibit or really discourage the city from offering services like housing and shelter to unhoused folks. So I'll do the next slide. Thank you. So what does the injunction actually prohibit? It deals specifically with homeless-related laws that prohibited essentially sitting, sleeping, lying, and existing in public when folks have no real other alternative. The injunction specifically protects folks who are quote-unquote involuntarily homeless. What that basically means is people who don't have the real alternative to be indoors. It doesn't protect individuals who, if given a real valid shelter offer and for some reason decline, they are not offered the protection of this particular injunction. And like I said, it's a preliminary injunction, so that means that it'll last for until there are findings at trial. And again, that trial won't happen until October 2024 as of right now. Professor Rankin and Jennifer touched upon this earlier, so I'll just go really quickly about how sweeps don't work. Again, they're complaint-driven. San Francisco police officers respond to complaints on a daily basis, which of course leads to those dispatches being incredibly expensive. Police officers are not social workers. They are not equipped to actually provide services to folks. And at the end of the day, for the reasons expressed earlier, they're counterproductive on top of being really expensive. Next slide. So one of the things we wanted to address head on is, and folks may have heard some maybe misinformation or confusion with regards to what the injunction does or does not. But we're also hearing more and more about this idea that San Francisco is claiming that unhoused folks were rejecting shelter left and right. Again, our entire preliminary injunction, which we had to support in court, established that San Francisco was not actually truly offering folks alternatives or shelter offers. Again, the 3,000 times we named it in San Francisco did not come back to show that they actually were offering shelter opportunities. And that's because what San Francisco actually does is when it does supposedly offer shelters, those are often illusory. They're illusory because San Francisco, of course, is thousands of beds short. So it's hard to offer what doesn't exist. Also, part of our court filings were testimony from a couple former San Francisco employees and also experts who confirmed that the city incentivizes having misleading shelter refusal information. So if you go to the next slide, we can talk about what happens on the ground. So San Francisco will sometimes mark down as folks refusing shelter, even when city workers haven't actually engaged folks. And that's because they don't necessarily have the actual opportunities. You look at some of the paperwork that the city presents in which they claim that folks have refused shelter, yet on the very same line, there'll be remarks saying about how people actually were asking for shelter. So it's really hard for San Francisco to pretend that they routinely are able to offer folks shelter, just given the acute shortage that we have. You know, on a daily basis, San Francisco maybe have a dozen or so openings for the thousands of folks who are on the street. As we mentioned earlier, before the pandemic, there were over 1,000 people waiting on a shelter wait list. San Francisco recently reopened that shelter wait list, and there are 500 folks right there waiting right now to want to try to access shelter very much so. And if you look at historically, when San Francisco is actually able to provide shelter, folks absolutely accept. So when they're at very high rates, so things like navigation centers, when there were the shelter-in-place hotel spaces, the rates of acceptance were extremely high. And so one of the things that Professor Rankin mentioned earlier, that there may be some reasons that folks may decline, and we really should look at those, because it is uncommon for us to hear about individuals who were not asked, who are not assessed for actually shelter that actually meets their needs. For example, folks with disabilities who are offered top bunks, or individuals who would need to separate from their family, and the like. And so such instances like that, you know, folks make rational decisions, and so the shelters that San Francisco does offer, the few instances that they do, just aren't appropriate and aren't meeting folks' needs. So I'll go to the next slide. Jane Friederbach mentioned earlier some solutions to homelessness. I just want to name some really more concrete, specific ones. Obviously, increased affordable housing is the main solution to homelessness crisis. But right now, for example, San Francisco has hundreds of vacant supportive housing units that are empty. And San Francisco could make a really big dent right now if they are able to fill those units, as opposed to allowing them to remain empty due to a bureaucratic delay. There is also right now a fund, the Prop C fund, which is one of the main campaigns that the Coalition of Homeless did, leading to millions of increased dollars of funds to provide increased shelter beds, housing and services and the like. So San Francisco has recently been able to increase some shelter beds, and that's directly as a result of that Prop C funding and the coalition's campaign. So we want to use those fundings, not use cops, actually have outreach workers who can actually provide services. And also there's a coordinated entry system that allows for that does right now a relatively poor job of matching people to their needs. So I'll end, I think, one more slide next. We'll send this link out, but this QR code will take you to an action alert in terms of to write to the city with regards to some of these very concrete solutions, and also advocate for addressing this current lawsuit that we have before the city. But we'll send this link out, but we wanted to present it to you here. And I'll pass it back to you, Bianca.
Yes, thank you so much. Thank you so much. I feel like I've already learned so much and definitely coming away with the sense that one of the real solutions is affordable housing. But I am seeing, and thank you to everyone who submitted questions, I think an issue and a question that comes up very often, and I'll probably ask Jenny to get us started, which is this sense that one of the big reasons and one of the big causes of homelessness is substance abuse. And that, people are homeless because they're on drugs and there's not much that we can do about it. What are your thoughts on that, Jenny? And what are important things that people should know?
Yeah, absolutely. Thank you. It's very concerning, of course. We have large numbers of overdoses and increased rates of addiction of all people during the pandemic, but in particular, unhoused people's rates went up. What it's really important, I think, for folks to recognize both at two ends. First of all, the rates of homelessness or the rates of addiction disorders upon entrance into homelessness is very low. But as people are homeless for longer and longer, those rates increase. So in other words, homelessness itself the trauma of homelessness is driving addiction rates up. And secondly, it's very, very difficult to address those substance use issues if folks are unstable and are continuing to be traumatized. So getting folks into treatment and making sure once they leave treatment that they're not returning to the streets. What we heard in our study that we did is that people were feeling good about treatment, they were addressing their needs, but then they were put back on the streets and felt like the rug got pulled right out from underneath them, and all that success that they had suddenly went away. So those would be two things I would want to point out.
Thank you so much. And Professor Rankin, any thoughts?
Yeah, I think one of the things that should be clarified too, because I see it come up in many instances, is the confusion between homelessness generally and chronic homelessness in particular. Because you'll hear folks say, including the work that I had sort of pointed to at the top of the hour, that that drug addiction is not a major cause of homelessness. That is accurate because in the larger population of homelessness, the vast majority of people experiencing homelessness are not suffering from substance use disorders. When you talk about folks who are suffering from chronic homelessness, there's actually a federal definition for that, and it means that they have to, just simplified version is, it means that they have to have been homeless longer than the vast majority of people who are homeless only episodically or very temporarily. And they have to suffer from a disabling condition that prevents them from working or maintaining housing on their own. And that can be a chronic health issue. It can be substance use disorder. It can be physical challenges. It can be a co-occurrence of a bunch of those different things. When you talk about people who are experiencing chronic homelessness, the percentage of folks who are struggling from substance use disorder does go up because just by definition, they have to have that disabling condition. So I think that's really important for people to understand, because a lot of folks think that the homelessness that you see in encampments or on the street is what homelessness is, and it's not. So when you hear a difference in terms of where somebody's saying, "Oh, it's not a major contributor to homelessness," they're talking about homelessness in its entirety, in general. It's a more pronounced problem with respect to people who are chronically homeless, because it's a required part of the definition of what it means to be chronically homeless. Now, with respect to chronic homelessness, I would point people to, I typed in some thoughts in response to the first person who issued a question along these lines in the Q&A. And so you can see I have like 5 tiers of a response to that. But some of our other speakers had already mentioned the shelter waiting list as being several hundreds of unhoused people. People who have been given offers for shelter know from experience that, and if somebody's saying, "Hey, you should go to a shelter," they know from experience this wait list has been that long or longer for years. And so they know from experience that when an offer of shelter is made, that it's most often not a real or meaningful offer of shelter. And so that's really important. You can look at the list yourself and see how many people want it that are not going to be able to get it. Also, John Doe mentioned a bunch of the things that exclude people or serve as a barrier to shelter, whether it's someone's gender identity or their criminal background, but substance use itself can be a barrier to accessing shelter. A number of shelters, and in some areas, the only available shelters, have rules that say that you must be sober. And you can't be have addiction problems when you come to this shelter. So it's all of those sorts of barriers that teach people that basically teach them, they've learned that those offers are not real or not meaningful for them the vast majority of the time. So that's sort of like they've learned to decline it. But when people, I'll say one other thing is I did try to put a link in there. The ACLU of Southern California did a scathing report on the conditions of shelters in California that were showing really unsafe and unhealthy conditions. You can look it up yourself. It's called "This Place Is Slowly Killing Me." It'll really put into context another reason why rational people decline shelters, an offer of shelter. Having said all that, when people are offered reliable, real housing that is dignified and safe, we often see acceptance rates skyrocket to the 90th percentiles. And then finally, for people who suffer from substance use disorder or drugs and addiction keep coming up, there are landslides of reports that show that treatment alone is ineffective without housing. There was a major study that was released earlier this year that showed it was of 1.2 million patients. And it showed that the large majority of people who entered into substance use treatment programs without housing unsurprisingly returned to homelessness. So being able to separate out substance use issues from the homelessness crisis is really important here. The answer to that for people who are chronically homeless is to do a better job investing in permanent supportive housing, which is, when properly done, is done in a housing first context and provides housing and offers voluntary treatment to residents. So you can look up, there's a lot of information on that too on the Third Door Coalition website.
This is so helpful. And I just want to add one additional perspective, because several of the doctors at UCSF actually signed on in support of our litigation, talking about the mistake of correlating the homelessness crisis with the drug crisis. And they cite to some really important new social science research that tests this exact problem and looks at the places in the United States that are most impacted by the drug and opioid epidemic. So looking at places like West Virginia or Alabama, where there are remarkable rates of addiction in the population. And yet you see that there isn't dramatic rates of homelessness in that population. And so even though addiction rates are extremely high, people are able to stay in their housing. And so what that really drives home is that homelessness, again, as we've said, is an affordability issue. There can be an overlay of the drug crisis. Those are two crises that the United States is facing. That does not mean that they're actually the same root problems. And so I think, as we've noted, of course, when someone is forced to sleep on the streets, can't afford rent, and of course, we know most people who become homeless in San Francisco are longtime residents who can no longer afford to live here. You can imagine, frankly, after being forced to sleep in a tent outside for months to years, some people do develop substance use challenges. That doesn't mean that those are people who had substance use challenges when they were struggling to make ends meet and could have used the assistance of affordable housing to really avoid a personal crisis, but now a social crisis for our community. And that's just one of the examples of the way that homelessness is actually costing all of us, and that the solutions to homelessness, the provision of affordable housing, it reduces all of our costs across the system in terms of healthcare and housing costs, in terms of drug treatment and programs, in terms of jail and hospital costs. And so I think all of that is a really important way to sort of tease out how these issues are at once related, but actually quite distinct. And we can't view them as the same if we want to make real headway on the homelessness crisis.
Thanks so much, Zal. And I think sort of switching gears a little bit as we have a little bit of time for more questions. I think one question that's come up is, can you talk a little bit more about the charges for the people who are being arrested? As we mentioned, that one of the issues that we've seen is quite a bit of criminalization. So unhoused people being arrested for different things. Can you talk about what some of those charges might be?
Yeah, so I'll rattle off a couple examples. And of course, John, please jump in. What we see most commonly in San Francisco is enforcement of sit-lie laws. So that basically threatens an unhoused person with citation or arrest just because they're sitting or standing in a public place. And then we also see commonly illegal lodging, which is basically if an unhoused person has stationed themselves with anything, even a blanket, frankly, over their head in a public place, that is viewed as illegal lodging. And the third and most common bucket really in San Francisco at this moment is that when an officer tells an unhoused person, you need to leave this block, and the unhoused person says, where can I go? And the officer says, I don't know where you can go, you just can't be here. If the unhoused person refuses to leave, then they're cited with failure to obey an officer. And of course, that happens. It's happened hundreds of times over the last several years, but those are the three most common citations we're seeing at the moment.
Great, thank you. And again, thank you so much. Everyone's asking such wonderful questions. I think this will be the last question, and I'll ask all of you, our panelists. So San Francisco District Attorney Brooke Jenkins was asked during a panel earlier this week what the city should do when unhoused people who are offered a shelter bed decline. And her response was, they have to be made uncomfortable is the truth of the matter. We cannot make it comfortable for them to pitch a tent on our sidewalks and stay. What do you all think about that? And I'll start with John.
I think my response is, I think it's pretty uncomfortable that folks have had to be outside to begin with. So this idea that they need to be harassed or made frankly, it's concerning. It essentially almost calls for some vigilante justice as well of some sort. So it's actually really troubling for me to actually hear that, to essentially just harass folks so that folks will just leave, but leave to go where?
Yeah, no, I have to agree with John, and I do think it's concerning in terms of what it raises for whether or not the city's actually complying with the injunction against it that clearly says that it should not be enforcing these sit-lie and anti-homelessness laws when it obviously does not have shelter access for thousands of people. And of course, I think in the vilification of the unhoused community, there's this sense that, or this underlying sort of implication that people don't belong here, that they're not from here. And of course, we know the numbers. We've seen the most recent studies from UCSF. It's 70 to 90% of people who were living and working in San Francisco prior to becoming homeless here. Again, the vast majority of those people were living here for a decade or more before being priced out. So in fact, a lot of the unhoused people have more of a claim to consider themselves San Franciscans as many of us. And so when you look at that and see that the city is actually turning its back on its most impoverished residents, on its long-term residents, to make way for gentrification, ignoring skyrocketing rents and how that impacts low-income communities that are from here, it's really is disingenuous and it's deeply concerning, and it's not going to result in the city having less homelessness. As we've established, it's going to result in an even more exacerbated income inequality, and that's only going to harm the community.
Yeah, I just want to add, I guess we could call that comment, it's really 1990, but it's already been a tried and failed strategy. So that's what, I've been doing this work for decades, and that's what the policymakers have been doing and trying over and over again. If we just make it uncomfortable for folks, they will disappear. Guess what? Folks don't have disappearing power. That is a superpower that unhoused people don't have. So, and it also, as we pointed out, wastes resources and actually exasperates homelessness. So I think an opposite way of thinking about this is actively engaging unhoused people into services, building trust. And when we've done that in San Francisco, we've been wildly successful, whether that was the King Street encampment removal back under Mayor Lee, whether that was the early homeless department encampment resolutions, like the one at Islais Creek that had 70% placement rates. And now we have the situation where, with this big use of force, with the police going out, there's 0 placement rates. With the homeless, the Healthy Streets Operations Center, it's between 30 and 50% placement rates. But when we're doing it with the best team out of DPH, all of their clients are getting into housing. And so it really is we got to look at what works if we want to solve this issue. If we want to continue our failed response, then we should do what DA Brooke Jenkins is asking for.
Great. Well, I see, I feel like we could keep talking about this all evening. I really want to thank our panelists, and just a reminder, thank you so much to everyone who's attended. We will be sending an email with the link to this recorded presentation, and also some of the resources that we mentioned. And again, we had some really great questions, and it's terrible that we didn't have time to answer all of them. But again, you have all of our organizations and our contact names, and please feel free to reach out to our wonderful panelists who would be happy to answer more questions. But again, thank you so much, Professor Rankin, John, Jenny, and Zal, and thank you so much to everyone who participated. And we hope to see you again for future conversations. Thank you.
Thanks, everyone.